This is 5 Minutes to Change Your Life. My name is Joanne Mallon. I'm an author and coach. I love helping people make wee changes that make a massive difference in their lives. Give me 5 minutes of your time today. Just might change your life.
Hey, hello, what about you? We are talking today about the body and specifically dealing with aches and pains that you might be feeling in your joints. I get this from time to time. Do you? It's very common, isn't it? That's not very nice. No fun at all. So, how do we prevent this kind of joint pain from happening? And how do we deal with it when it does? I've got some really good practical tips for you today from my expert guest, Dr. Sarah Mottram. Sarah is the founder of the Healthy Movement Program. She's been studying how we move for many years. She traveled all over the world with this, worked with top athletes, and even at the age of 60, she did a PhD in healthy movement. What an inspiration. So if joint pain is an issue for you, please do take a look at Sarah's website, which is themovementworks.co.uk, and you'll find some really good resources, articles, and videos that will help you to move towards pain-free, healthy movement. That's what we all want, isn't it? It's very much a science-backed approach and extremely practical, so please do check that out. But first, here's Sarah.
If you find yourself experiencing long-term back or neck pain, you'll probably get in touch with your GP, and they may prescribe painkillers or refer you to a specialist. But while traditional treatments can offer some relief, for many of us it's only a short-term fix. And that means we just put up with ongoing joint and muscle pain, along with restricted movement, often for years, sometimes even decades. We may feel like we've tried everything, but nothing has given us the long-term results that we need. And we start to wonder if we just have to live with the pain. The issue is that many conventional approaches focus on the location of pain. But pain is a symptom, not the problem. It's all connected with our neurophysiology, or how the brain interprets pain and how we move. Pain is really a warning sign. So rather than just managing symptoms, we should be looking at what's behind the pain and finding the underlying issue. We need a holistic view. When you know how to look after your movement and keep pain at bay, you can do it every day. A few simple changes can free you to move more and re-engage with life. And the more you move and enjoy life, the more you reinforce healthy movement. Here are 5 daily habits that we can all make to help restore healthy movement in our lives. My first piece of advice is to practice active sitting. If you're driving, for example, try to avoid slumping or sinking into your seat or turning into a C shape. Practice active sitting. This means being mindful of your body and being more aligned. When you realize that sitting can be active, it's a game changer. The second tip I'd like to share is to mix up your movements. Movement is complex and multi-directional, and variability is very important. You need to walk on different types of ground and gradients daily to keep your body using different muscles and joints. If you're not conscious of this, you risk losing movement variability as you age, and once this becomes a habit, it can lead to pain. My third tip is about moving more in your chair. Do you work from home, or maybe you sit a lot while relaxing or socializing? I recommend using a timer, around 40 minutes, as a reminder to check your alignment and introduce small movements. This doesn't mean you have to stand up. It's the movement itself which is key. For example, try gentle exercises like reaching your arms overhead, twisting gently from side to side, or tilting your pelvis forward and back. My fourth tip is to be conscious of your breathing. How you sit influences your breath. Slumping compresses the diaphragm, which makes your breathing shallow and inefficient. While you don't have to sit bolt upright, sitting in a more open and active way allows for better diaphragmatic breathing. You might want to try this. Place a scarf or band around the base of your ribs and gently hold it. As you breathe in, direct the air into your lower lungs, expanding the back and sides of your rib cage. Inhale slowly for a count of 4 through your nose, and then exhale for a count of 4 again through your nose if you can. This mindful breathing technique can help you reset patterns and encourage relaxation while promoting better movement. My final tip is to increase your awareness. The secret to making this work is to put it all together. If you can become aware of your mind and body and how you move, think and feel, it will allow you to make better choices. If you feel discomfort, pause and check in with yourself. Notice how you are sitting and how you are breathing. If you can make small adjustments, you'll soon start to notice the difference. So in summary, those 5 tips for healthy movement are: practice active sitting to be more mindful of your body. Mix up your movements to keep using different muscles and joints. Move more in your chair. Be conscious of your breathing and increase your awareness to make better choices. If you can make these small, simple adjustments, they will add up over time and help you to move away from pain. And who wouldn't want that change in their life?